All right, how are you? This is your lecture for chapter 10, starts on page 105, and this is the role of complementary and alternative therapies in pharmacology. Before we go further, let's break down what that means, yeah? So, the role of complementary and alternative therapies. If we think of the term complementary, what does that mean, right? To complement. You're already doing something for your disease. This is only going to complement what you're already doing. So what you're probably already doing is taking a prescription medication for a certain condition, and now we're going to complement it with something else. Where the drug you're taking is prescription, most probably, right? This is going to be either over the counter or something related to your culture that you're doing that's going to complement the medication to make you feel better. Does that make sense? So it's the role of complementary and alternative. What do we mean by alternative? Other than prescriptive. Because if it's prescriptive, that's the mainstream. So mainstream Western medicine is you go see a doctor, you get diagnosed, you get a prescription, mainstream. But what we're doing is alternative. So you're complementing the mainstream approach with something alternative. That's either over the counter or something related to your culture that you feel is going to make the medication work better to make you feel better. So what do I mean by that? Because I keep saying to culture, right? So we really got to understand what we mean by a complementary and alternative therapy. We'll call this CAM. Turn the page, and it's right there on page 106. Second section right there where it says 10.1, complementary and alternative medicine, and you have a definition for the word CAM. So it says CAM is complementary and alternative medicine, right? Comprises of an extremely diverse set of therapies and healing systems that are considered by many to be outside of the mainstream Western healthcare practice. When they say the Western world, they mean this side of the planet, the west side of the planet. This is considered the most modern approaches to medicine, right? Western medicine. When you're thinking of Eastern medicine, you're thinking of Asia, you're thinking of India, you're thinking of all of the Orient, and the types of alternative medicine that kind of goes. It's more alternative, more culture related. So that's the Eastern medicine and Western medicine. Our focus of Western medicine is more prescriptive drugs. However, I keep saying that there's more than just medication that is CAM, that it kind of relates to your culture as well. Look at that table at the bottom of page 106, table 10.1, because this literally breaks up all the different categories of alternative approaches that are considered to be CAM, yeah? So let's look at that from top to bottom, yeah? It just says the first one is going to be a nutritional, so CAM can be nutritional. You're already seeing a doctor, you're already taking medication, but you're going to take some certain foods that are going to make you feel better that complement the medication. Look at the examples it gives for CAM that is nutritional. On the right-hand side, dietary supplements, herbal remedies or therapies, and your probiotics, right? More on all three of those in just a bit. I just want to designate what the heck is CAM. So CAM can be nutritional approaches that are alternative, right? Look at the second one. Physical approaches, what do we mean? Acupuncture, chiropractors, sometimes some Western medicine, some doctors are very against chiropractors because technically they don't go to medical school. They go to a different approach of medical school. I want to say it's a doctor of osteopathy as opposed to doctor of medicine. So there are some physicians that are very anti-chiropractors. I've gone to chiropractors in the past because I've had back issues ever since I was a teenager, and it's worked wonders for me. So I think chiropractic is good. It has its place in Western medicine. But other physical approaches, right? We have acupuncture, never done that, not interested. Chiropractor, hot and cold, hot compresses, cold compresses. You hit your arm, you put some ice on it or whatever. I'm going to give you a little tip that comes from sports medicine related to applying heat or cold to an injury. If the injury occurred right now, ice is the best thing that you can do because ice will decrease inflammation. It'll limit the amount of damage from trauma. So when trauma is immediate, ice. But if the trauma happened yesterday or hours ago, ice is not useful anymore. The swelling has already taken place, so you need to add heat to promote vasodilation to decrease the swelling. Does that make sense? So ice is for immediate injuries and it's to prevent swelling. But if the swelling already occurred, then the injury needs heat so that it can vasodilate and decrease the swelling. That's the approaches to cold packs, hot packs. Either way, when you're in the hospital, you need a physician order. You can do something minor, like just put something in, a little bit of ice just to kind of help them out. But a prescribed ice pack that's going to stay on for a certain amount of hours or certain amount of minutes and then rotate it to another side and then refill it, that's going to require a physician order in the hospital most of the time, right? So again, CAM can be nutritional, CAM can be physical, CAM can be psychological. Look at this. We can have biofeedback. I don't know if you're familiar with that, but you can Google that. Biofeedback is the whole principle that a lot of the functions in your body that are involuntary are actually voluntary if you practice enough to get them under control. So what are we talking about? Most headaches are vasodilation. So if you do the biofeedback approach, you concentrate, and force your blood vessels to constrict to get rid of the headache. So the principles of biofeedback is that you can actually increase your heart rate by thinking about it, decrease your heart rate, vasodilate, vasoconstrict, shunt blood into one area of the body just by thinking about doing it. Whether it's true or not, I don't know enough about it. Never had the time to explore it any further, but it's out there and it's been in the textbooks ever since I came into nursing back in 1998. So there must be some benefits to it that it's still in the textbooks even now, 30 years later that I'm still in the field. But other psychological areas of CAM can include biofeedback, faith, and prayer. Isn't that amazing? I'm not a religious man. I don't believe in monsters and gods. I believe in science. I believe in what I can see. But I don't have a problem with people believing in gods and religion, and having those kinds of beliefs. That's fine. If it doesn't hurt anybody, knock yourself out. Now, there is some benefit to prayer and faith. There are research studies out there, I can't name them, but I'm pretty sure you can find them in this day and age, that talk about how there's experiments where a group of people pray on one patient, but they don't pray on another one, and there's better outcomes for those that are prayed upon. Why? How does that happen? Who knows? I don't think it's a miracle. There's a scientific explanation for that. You figure that out, you become a millionaire, you give me a nickel out of every dollar, right? But there is research out there that prayer is kind of technically meditation. You hit certain levels of theta waves in the brain. It does calm you down, bring down the heart rate, so it does decrease stress. So there is some benefits from prayer per se, which I would probably scientifically just call guided meditation, but there is benefits to it. So by all means, yeah. And you always have to respect the other individual's health beliefs. You, the nurse, adjusts to different people, And I've prayed with Muslims, I've prayed with Christians, I've participated. The only thing I draw the line on is if you're gonna set fires or kill animals and sacrifice, that's kind of where I draw the line right there. But for the most part, I'm open to all religions, all faiths. But me personally, no, I'm a man of science. Everything that I've seen is concrete. I need evidence. I need reproducible results. Does that make sense? But you need to keep an open mind because we don't know what we don't know. There's a lot of mysteries in the universe there, right? A little bit further down, last but not least, combination of the physical and the psychological. Pilates, Tai Chi, yoga. I would add martial arts in there as well. There is benefits of just activity. You're combining both the combination of the physical and the psychological, and martial arts is a really great approach to that as well. So now all of these are considered CAM. So we have nutritional, physical, psychological, and a combination of the physical and the psychological. Our focus for this book is going to be the first one, nutritional, and then which includes dietary supplements, herbal therapies, probiotics. That's where our focus is going to be for CAM in this course. But CAM is going to come up in Adult Health 1, 2, and 3, incorporating all of the acupuncture, the cold hot applications, massage, biofeedback, Pilates, all of that gets added on later. Good? Alrighty. If we keep moving, the main parts of CAM that we're going to focus on is probably going to be herbal supplements over-the-counter remedies, those types of things, yeah? So in fact, if you look on the next section right there, page 106, 10.2 talks about the brief history of herbal therapies. This is where all medications actually originate from. They originate from plants that we find, and then we melt them down or burn them down and pull extracts out of them, make concentrated dosages, and then that's where medications come from. So just because it's herbal, just because it's natural, doesn't make it 100% safe. And keep in mind that just because it's herbal, natural, over the counter, doesn't mean it will combine well with whatever prescription drugs that you're already on. Too many to memorize, but there's some choice ones that the NCLEX is definitely going to ask you on. We've been saying these for years, and now it's your turn to learn them as well. So away we go, yeah? So over on page 107, pull out your highlighter because table 10.2 has several herbal remedies, all of these, but I'm going to tell you to highlight the ones that I know for a fact NCLEX is going to focus on because these are the herbal or over-the-counter remedies that counteract with a lot of popular medications. So if we go from top to bottom, the list is in alphabetical order. So it's not an order of importance or anything. It's all alphabetical order. So at the very top, hop down to the letter B, and I want you to highlight the term black cohosh. Black cohosh. If you'd like, you can pause the video, Google image, so you can see what black cohosh looks like. It is a plant, it's a root. It gets combined into pills, and if you look on the right-hand side, what is it for? It's to reduce menopausal symptoms. So this helps with hot flashes, because once women hit menopause, they're already in their 50s, 60s, 70s, they start with a lot of hot flashes that are very intolerable or sometimes interfere with activities of daily living. Black cohosh is a root that can be consumed to help alleviate hot flashes. Very common NCLEX question there, so keep that one in mind there, right? Just out of curiosity or just there, if you notice right under there, cannabis is on there, right under black cohosh. We don't use the word marijuana. Technically, marijuana is considered a racist kind of term now that they've investigated it because it's pinned to the lazy Mexican who smokes marijuana, the name of the drug, right? So the correct term now is cannabis. And look at on the right-hand side how, yes, it's the leaves. Now in like Nevada, for example, that it is legal, that you can buy it. Look on the right-hand side, reduces anxiety, improves sleep quality, reduces chronic pain, and also inflammation. Fantastic drug for post-traumatic stress disorder. It is helping people that are addicted to opioids to come off of opioids. It's best that you smoke pot as opposed to taking opioids on the regular. And not only that, but it's also decreasing the rates of suicide against post-traumatic stress disorder from people that come back from the military that have seen some action, and then they can't adjust to normal life again. The marijuana seems to take the edge off, and it helps prevent rates of suicide, and it also helps decrease rates of addiction to opioids as well. So there is a use for cannabis. Look at that. However, cannabis has been around for a while, even in the pharmaceutical industry. It does come as a pill form known as Marinol. Marinol used to be given. It was a pill, THC pills that were given to cancer or HIV patients to promote appetite. You give them the munchies, right? And get some calories in. We continue. Look at the next one, cranberry. I'm sure some of the young ladies in the class would agree that cranberry juice, in particularly, if you look to the right-hand side, prevents urinary tract infections. The science behind it is you consume the cranberry juice, it goes through your liver. Once it hits the bloodstream, it's very acidic, and it changes the pH of your blood. It changes the pH of mucus secretions, in particularly in the vagina, which creates an acidic environment in the vagina to prevent it from UTIs developing, E. coli being the most common UTI. But that's the whole scientific reasoning behind cranberry juice. It's to improve the acidity, which drops the drop in pH, increases the acidity, and it's the vagina's defense mechanism to prevent UTI infections, right? Right under that one, you have the term or the herb echinacea. Never taken it in my life, but I do know that some people swear by it. Apparently, echinacea, right-hand side, enhances immune system, treatments for the common cold. I've heard of people that the minute they have a little sore throat, oh, I can't get sick, I've got stuff to do this week, they rush and they take their echinacea. Some people swear by it. They say the echinacea actually works. It shortens the length of illnesses or prevents illnesses altogether. I have no experience with it. I'm pretty sure there's research out there because it's been repeated over and over in nursing and pharmacology courses. And here it is still 30 years later that from when I was taking a pharmacology course to now teaching a pharmacology course. So echinacea, very popular. I know a lot of celebrities kind of take it. Because they want to prevent having to take a prescription drug, and they want to stay healthy because they got a lot of activities to do. We keep moving a little bit further down. The G's. The G's. Remember, all of these that start with the letter G. Garlic, ginger, ginkgo, ginseng, heck, even green tea. If you look to the right-hand side, garlic reduces blood cholesterol, reduces blood pressure, in particularly anticoagulant. So garlic thins out the blood. You need to know that. You're going to get NCLEX questions on garlic. Look at the next one. Ginger, right-hand side. Antiemetic, which means it helps with nausea and vomiting. Antithrombolytic, which means it breaks clots apart, which means it thins out the blood. So G for garlic, thins out the blood. G for ginger, thins out the blood. What else does it do? Increases blood glucose, stimulates peripheral circulation. Got it. Look at ginkgo. Ginkgo can be used to improve memory, reduce dizziness, but it also thins out the blood. In fact, look at the next one of the G, ginseng. Ginseng also reduces stress, enhances the immune system, decreases fatigue, but it also thins out the blood. So keep in mind, if an over-the-counter substance starts with the letter G, it most probably thins out the blood. So that means they are contraindicated for anybody that's taking a blood thinner already. So if you're going to get CAM questions on the NCLEX and you're only going to get one or two questions, it's probably going to revolve around the G's. You need to know that if patients are taking blood thinners, they got to watch out with over-the-counter supplements, in particularly garlic. Just to bring the point home, turn the page, page 111, table 10.5. These are selected herb and drug interactions. Look at the G's, garlic, ginger, ginkgo, ginseng. Right-hand side, it says may interact with aspirin, which is a blood thinner, warfarin, which is a blood thinner, heparin, which is a blood thinner. Look at the ginkgo also, aspirin, heparin, warfarin. Look at the ginseng, warfarin down at the bottom. You see that? So if it starts with the letter G, ginger, especially garlic, ginger, ginkgo, and ginseng, it is contraindicated with a blood thinner. So what are your patient education going to be? If you start having unusual bruising or nosebleeds, you see that? Or God forbid, you start having frank bleeding whenever you have a bowel movement, or hemorrhoids that keep appearing, you see that? This could be an interaction between your blood thinner and you probably took something with the G. So sometimes the patients are not consuming these artificially. Maybe it's the foods they're eating. So if you got Italian Americans that are cooking with a lot of garlic, with a lot of pasta sauce and stuff like that, that could be the connection. So this is why we need to ask, what are you eating on the regular? Not necessarily what are you taking, because I've never heard of it. I mean, I've never taken a garlic supplement, but I've eaten a lot of garlic. There's been periods of time where, for whatever reason, I'm on vacation or something and you're eating a lot of Italian food and stuff of that nature. So keep that in mind. Anything that starts with the letter G is probably going to thin out the blood. It's probably contraindicated with a blood thinner. Examples of blood thinners: aspirin, heparin, warfarin, also known as Coumadin. You don't have to know those drugs just yet. We'll get to those drugs. But what you do need to know is that garlic and anything with a G thins out the blood. Yeah. We keep moving. There's more that are popular CAM as well. A little bit further down, milk thistle. I'm back to page 107, table 10.2. Milk thistle. These are capsules, and it says used as an antitoxin to protect against liver disease. In fact, patients that have hepatitis, patients that are recovering from hepatitis, patients that are alcoholics, patients that are recovering alcoholics, milk thistle is often recommended to them. It helps the liver detoxify. It helps kind of realign your enzymes. It helps reestablish your cytochrome P450. It helps your enzymes in the liver altogether. So anytime you think of somebody liver failure, this might be a supplement that might benefit them. We do not recommend them as nurses because the role of the nurse is not to recommend medications or to prescribe medications unless you're a nurse practitioner. But at our level, what we're doing is we're just educating the patient. So you don't tell them, oh, do you have liver failure? You should start taking milk thistle. No. The way you say it is, oh, do you have liver failure? You should talk to your doctor about potentially adding milk thistle to your routine. So you always add that caveat. This is a great conversation for you to have with your doctor, because in nursing school, I learned that this is really good for your liver. I don't know if it might be good for you, but you should ask your doctor about that. That's the way you guide conversations. Be careful. There's a liability if you tell somebody to take something and they do it because you're a nurse. You see that? So be careful. Stay within your scope of practice. A little bit further down, next one, saw palmetto. Saw palmetto. These are berries put into pills, and it's prostate health. So the saw palmetto helps decrease prostate inflammation. So usually when you hit your men, this is men obviously, when you hit your 40s, your 50s, there's a little bit of prostate inflammation that happens naturally. That's expected. Now, if the inflammation is to the point that it's already causing pain, discomfort, or not allowing urine to flow out, now we got a problem. Now we really got to see a doctor for this. Once medications are added on, sometimes saw palmetto is recommended by the physician to complement the medications for prostate inflammation. Make sense? Then there's the next one, St. John's wort. Oh, I call this the poor man's Prozac. St. John's wort is an over-the-counter antidepressant. How about that, right? So if you move to the right, it says its flowers, leaves, and stems, they're crushed, crunched, and put into pills. They reduce depression. They reduce anxiety and also have some anti-inflammatory property. So what it is that it increases your serotonin levels. Serotonin is a neurotransmitter in the brain that when serotonin levels are low, signs and symptoms of depression develop. So what this drug does, it increases your serotonin levels. However, there is such a thing as serotonin syndrome, like your serotonin is way too high. So where would St. John's wort be contraindicated? When you're already on an antidepressant that increases your serotonin. So if you're already on an antidepressant that increases serotonin, a serotonin reuptake inhibitor, more on that later in the course, and you take also St. John's wort, you're going to get that serotonin to go through the roof. You're going to end up with serotonin syndrome. Your temperature starts to go, you start to burn up from the inside out. So that can be a medical emergency. That is a medical emergency. So that's where your patient education comes from. Yes, you can take this over the counter to help with symptoms of depression, right, or low energy, low fatigue, But you got to keep in mind, if you're already on an antidepressant, this could make the situation worse. So definitely let your physician know. If you're going to see a psychiatrist, let them know that you're on St. John's wort so that they don't prescribe, or at least educate you to come off of it before they start a new medication. Excuse me. Last but not least, down at the very bottom, valerian root. This is for sleep. Some people will chew it. Some people take it as tablets. It says valerian root reduces stress, promotes sleep. So needless to say, don't chew it while you're already under the influence of alcohol. Don't take valerian root if you're already under the influence of an opioid. Do you see that? Because you're going to get an additive effect. You're going to get an agonist effect. And instead of making you a little sleepy, it's going to make you very sleepy. And it could put you into profound unconsciousness that could turn into an emergency as well. So there's a lot of things on this list, but those are the main ones that I know that the NCLEX might throw something at you, especially the marijuana that's newer because of it becoming more legalized and they're changing where it's at on the scheduled drugs. So there's a new rethinking right now about the use of marijuana. I said marijuana, right? Of cannabis. We're rethinking it. See, even me, I'm going through a transition, trying to drop the old term and move into the new term, right? So, Yeah, that's pretty much consolidated for you right there. Stay on page 107, left-hand side, down at the bottom. Beginning in the 1970s and continuing to the present, herbal products have experienced a remarkable resurgence, such that most adults, American adults, right, are currently taking botanicals on a regular basis and have taken them in the past. This increased use has been due to the readily available herbal products, aggressive marketing, very aggressive marketing by the herbal industry, increased attention to natural alternatives, and then renewed interest in preventive medicine. So a lot of people will take these because you're trying to prevent from getting sick. That makes sense? So preventive. Although I did highlight this one section that says the gradual aging of the population has led to an increase in patients seeking therapeutic alternatives for chronic conditions such as pain, arthritis, decreases in hormones such as menopause, prostate enlargement, and in addition, the cost of prescription medicine has driven patients to seek less expensive alternatives. So sometimes you can't afford your antidepressant. So what do? You take the poor man's Prozac, right? St. John's wort over the counter. Yeah. And again, this is in this country. You go to other countries, they don't have this type of freedom for people to be able to just buy things over the counter, right? But keep in mind, just because it's herbal, just because it's natural, doesn't make it safe. Any of these over-the-counters can kill you if you take enough of it, right? But I suppose anything can kill you if you take enough of it, right? So herbal product formulation starts on page 108. Not too much to really point out here other than maybe just highlight these few sentences in each one of the paragraphs. First paragraph, first sentence. The pharmacologically active substances in herbal products may be present in all parts of the plant or in only one specific part. That's why some of those that we just mentioned, some of it is the root, some of it is the stems, some of it is the flowers, sometimes it's the leaves. So it depends. It might be a different part of the plant that's being used to produce these CAM alternatives, right? Look at the second paragraph on page 108, and it says, most modern drugs contain only one active ingredient. This chemical is standardized, accurately measured, and delivered to the patient in precise amounts, I hope. It is a common misconception that herbs also contain one active ingredient that can be extracted and delivered to patients in precise doses, just like drugs. But herbs contain dozens of active chemicals, so it's not just one, many of which have not yet been isolated or studied or even identified. $1 million opportunity. If you can pick a CAM example and then get into the science of breaking it apart to see what's in it. It's right there. We haven't even discovered a lot of that. See that? These are $1 million opportunities. Look at the next paragraph. To achieve consistency, scientists have attempted to standardize the strength or dose of herbal products using either a specific active ingredient or a marker substance, such as a percent flavonoids, right, in ginkgo, or in percent lactones in kava. You see that? So it's just the way that they're trying to attempt to standardize a dose. That way you can say 30 milligrams of garlic in 2 different pills. It's the same. They're trying to standardize it. You see that? But the laws are very different for herbal and over-the-counters than they are for prescription drugs. In fact, you had this as a test question before, page 109, on the left-hand side, down at the bottom in bold, Dietary Supplement Health and Education Act of 1994. Remember, that's one of those 4 dates that I told you to highlight in chapter, I think it was 3. So look at that. That's the organization that actually monitors the dietary supplements in the United States. And trust me, it's not very tight regulation. It's very loose regulation because it gets complicated because you can't own the patent for garlic. You can't own garlic, you know? It's kind of like salt. It's a natural element on the periodic table. And if you sell salt, well, everybody should be able to sell salt. You can't own salt, you know? So it's a little tricky when you're trying to come up with how do you regulate natural substances that no one holds a patent for. Nobody holds a patent for ginkgo. Nobody holds the patent for garlic. Nobody holds the patent for black cohosh. So how do you regulate it? You see that? It's a little bit more complicated, yet less restrictive. There's more restriction over prescription drugs than there is over the counters. And that's what makes the over the counters even more dangerous The accessibility is what makes them dangerous. So how do we counter this danger? Us as nurses, educate yourself, and then educate others that a lot of these herbal supplements are not as safe as you think they are. I encourage you to go to Walmart. Next time you're at Walmart, next to Smith's, or wherever the heck you shop, go to the medicine aisle and just go take a look, see what the heck is out there. Go look at it. Just see the kinds of stuff that are over the counter. Read labels. Pick it up off the counter. Read what the active ingredients is. Is it more than one drug inside of them? Is it a natural remedy? You see that? Do they keep it locked up? Do they keep it available? Some of you that work out, maybe you go to like that protein shop. They've got supplements there too. Go look and see what kind of stuff is over the counter. So I encourage you as up and coming nurses to always go out of your way and go to the medicine aisles in all sorts of places, especially when you go out of town or something. Go to the medical aisle, go to the pharmacy and check it out. Just see what kind of stuff is over the counter, just so you can see what's available, because those are the types of questions you're going to get from patients. Look on the right-hand side, page 109. A major strength of this DSHEA is that it gives the U.S. Food and Drug Administration the authority to remove from the market any product that poses a significant or unreasonable risk. Because sometimes they're labeled as dietary supplements, right? But it doesn't make them safe. I'm going to give you a perfect example. There used to be this chemical. This is back when I was like about 24, 25 years old. Ephedra. It was a drug known as ephedra. And it was pretty much a stimulant. It was a plant and it was a stimulant. They have it in different forms, also known as fen or phentermine. But at the time, it was a capsule and it was a pill, and it was called, what did I say it? Oh shit, I forgot the name of it. Rewind. Ephedra. So anyways, it's the only time in my life that I had abs, but man, that stuff made me speedy. I was like high speed all the time, talking fast, running out of breath, always kind of sweating and stuff. It gave me a heart attack. I literally got a angina from it. The condition is known as Prinzmetal angina, which means a heart attack that comes from vasoconstriction of coronary blood vessels. The most common cause of Prinzmetal angina is cocaine overdose, but I'm not that interesting or fun. Mine was ephedra, and it literally did. It gave me chest pain, and I got a heart attack right at the gym, and I just chilled out and got up really slowly and went home. Later that week, a bunch of football players all across the country started dying on the field while taking it, and then that's when the Food and Drug Administration stepped in and pulled ephedra off the market. It was tricky because they pulled it off the market so you could not produce any more ephedra. But again, the law said, but the ephedra that's already out there, you could finish selling it off. So a lot of gas stations still had ephedra pills. A lot of GNC still had ephedra pills. And then they were trying to promote to sell them to get rid of them because they weren't going to make any more. So you can read up on ephedra if you want. This was back in the 90s, maybe like 2000, maybe like 2001, 2002. You can go back and read up on that if you want. But just as an example of how they can pull something off the market, and it was just a herbal supplement. You see that? So look at what it says a little bit. You got a bunch of bullet points here that just say that the DSHEA has several significant flaws that have led to a lack of standardization in the dietary supplement industry and less protection for the consumer, such as the following. That you can't prove that the medications work. So they really weren't regulating them properly. And even today, there's still some faulty regulation. For a little while, there was over the counter, there was testosterone, but it didn't come in the full testosterone form. It came in a form that you would digest it, and then your liver would metabolize it, and then it would turn into testosterone. So it was legal because it was illegal to sell testosterone over the counter. But this isn't testosterone. This is a pro-drug. Once you put it in your body metabolizes it and turns it into testosterone. That kind of stuff came off the market too. This was also back in like 2000, 2001. But just to give you an idea that, again, if it's over the counter, it doesn't necessarily make it safe. Here's another thing too, page 110. Look at that figure 10.3 and look at those advertisements on those things like L-carotene, mega fuel. It looks like extra big ass fries, right? What else does it say? Lipid buster, lipid blaster, advanced formula, 100% natural, right? Top tropical orange flavor, super energy formula. This is athlete's choice. Look at the top. No sugar. It's advertising. It's fancy advertising. Anytime you see something that says fresh, what the heck does fresh mean? You see that? It says natural. What does natural mean? You need to define what natural means that you're labeling it. Does it make sense? But once you see big colors, big letters, 1000% of vitamin C your body needs. Well, yeah, because your body can only take 100%. You're peeing the rest of it out. So don't fall for fancy marketing, which is getting better. Marketing now is even better. Now everyone's talking about peptides, because everyone's advertising on the billboards, peptides. So careful. It's all a game. It's all just people trying to make money off of people's insecurities or desperation that you're looking for something to lose that weight, something to make you stronger, something to make you more beautiful. Advertising. Be careful because it can influence what people take, and then that has consequences down the line. You see that? So if we keep moving, it just kind of talks about the pharmacology, actions, and safety of herbal products. Just that first sentence, a key concept to remember when dealing with alternative therapies is that natural does not always mean better or safe. That makes sense? Like I said, like the St. John's wort can cause serotonin syndrome if you overdo it with it, right? Look at some of these supplements that you've got done at the bottom of page 110, table 10.4. And these are some of the disease conditions that prompt people to get over-the-counter stuff. So let's look at some of the conditions and some of the over-the-counters that pair up with it. Like at the very top, again, alphabetical order. Anxiety, melatonin. However, melatonin for the most part is for sleep. Short term is okay. Long term, it's going to work against you. So I don't recommend melatonin for long term. It can get you out of a bind a little bit just to regulate your sleep cycle, but long term, it's going to cause detriment. It causes your body depends on it, and now you're not making any melatonin because now it's getting it externally. Yeah. Look a little bit further down. There you go. Depression, St. John's wort. Yeah, pin those two together. A little bit further down, glycemic management. What does that mean? That means blood sugar management. Your A1C for the diabetics, flaxseed, and also ginseng. Look at that. So ginseng will help with managing blood sugar. A little bit further down, hypercholesteremia. Your cholesterol's too high. So what can we do for that? Good old-fashioned garlic. You see that? But it thins out the blood, so be careful, right? That's why the Mediterranean diet, or people that live in the Mediterranean, has such low levels of cholesterol in their bloodstream, because the foods are rich in garlic that decrease that cholesterol in the bloodstream. Look at the next one, hypertension. We can give coenzyme Q, very expensive. Fish oil and the garlic, that's good. Fish oil and garlic can also help with hypertension. But you want to know what helps even better for hypertension? Cut your salt intake. For every sodium molecule, 4 to 5 water molecules hook up to it. So to consume a high sodium diet is to hold on to a lot of water. And a lot of water equals a lot of pressure. So if you want to drop your blood pressure, cut the salt. Cut the salt, it'll cut the water, it'll cut the pressure. You do that, and for 2 weeks, you can drop your systolic by like 3 points or something. There's some research out there about that. A little bit further down, insomnia, valerian root. Yeah, you could do that. A little bit further down, menopausal symptoms. We talked about that. Black cohosh. Look at that. For mental function, ginkgo. Apparently, it helps your brain functions to process information. It helps. It probably, I don't know what ginkgo does. It must do something with neurotransmission that it kind of helps impulses to go faster. But I'm speculating on that. If you're interested, you could research that if you'd like. A little bit further down at the very bottom, nausea and vomiting, ginger. Ginger root tends to help for that. Careful though, because some ginger is artificial. You think you're eating the real thing, and in some cases it's not even real ginger. I know that some people think, oh, it's pink. So if it's pink, it's real ginger. Not so. They use dye sometimes to give it that pink color. So not all ginger is actually natural. You got to be careful with it. Sometimes at the sushi places, you're eating at a cheap sushi place, it might not be real ginger. Alrighty, but overall, what we're talking about as well is the specialty supplements. So this is more than just an herbal. This is something that's chemically designed. It doesn't come as a natural product. It's got to go through the laboratory in some way so that they can prepare it before humans can consume it. These are your specialty supplements. So look at the definition of it in page 111. Non-herbal dietary products used to enhance a wide variety of body functions. Examples of these supplements, and this is not the complete list, this is just a few of them, is table 10.6. So at the very top is amino acids, and this is your protein shakes. So this is the guys that are working on, oh, I got one right there. Amino acids for the most part. Oh, I can't see though. But amino acids. It has all the minerals, vitamins, but your amino acids are going to be, where are they? It does not even specify them. It just puts them all as one. So protein for the most part. So tying the term, how much protein does this actually have? 50 grams of protein. I would have thought it would list it all. There it is, essential amino acids including leucine, in particularly, and that's all it advertises, just a leucine. But there's amino acids are divided into two broad sections. It's either essential or non-essential amino acids. Essential amino acids must come from the diet. Non-essential amino acids, your body already makes them. As long as you're eating food, your body will make them. So when we're talking about amino acids as a specialty supplement, we're talking the essential amino acids that must come from the diet. So this is technically protein, and this is technically for muscle building, bodybuilding, that kind of stuff, yeah? Move a little bit further down, coenzyme Q. Your body actually makes coenzyme Q. This is more of an antioxidant on a cellular level. When we mean antioxidant, it's because oxygen, when something gets oxidized, oxygen tends to break molecules down when it comes in contact with it. So oxidation reduction, it would be coenzyme Q. It just helps with oxidative stress. So I could see people saying that it prevents wrinkles because it keeps you from aging, and so anti-aging kind of stuff. Look a little bit further down. DHEA. This is a testosterone precursor. You take it as dehydroepiandrosterone. Your liver can convert some of this into androgens, into a little bit of testosterone. Not at the high levels that they used to before. Look at that. It improves, boosts immune functions and memory as well. So mood. Not as significant enough that it's going to start to build muscle or anything like that, but enough to improve nerve transmission and nerve function. A little bit further down. Oh, this one's fantastic. Glucosamine and chondroitin. Those are two chemicals in one. Glucosamine is, I believe it's a molecule, I know that, but then the chondroitin comes from shark cartilage. So they combine the two together, and this helps with all of your joints. It replaces cartilage that is damaged. It liquefies and it helps lubricate synovial joints throughout the body. But here's the catch. It's expensive. It comes in a big old bottle with a bunch of pills. And you got to commit to taking it regularly, because you got to keep taking it daily to keep the serum levels at the right amount to help all of your joints. So if you're not going to commit to taking it every day, it's not worth the money. But if you do commit to taking it every day and you make the expense and take it every day, you will see benefits in all of the joints. So fantastic for rheumatoid arthritis, osteoarthritis, things of that nature. It'll help complement some other prescription drugs, right? Right after that, you have Lactobacillus acidophilus. Notice how the first word is capitalized, the second word is not, but the whole thing is italicized. So those of you that know your biology, that's a genus and a species name. So Lactobacillus acidophilus is a bacteria. So we have this bacteria in our guts to help us digest. But if you're taking high doses of IV antibiotics, it's going to kill your normal flora. This is the normal flora replacement pill. So they have it as a pill. Sometimes it's in yogurt. So Jamie Curtis and her Activia were right? It's going to be in the refrigerator. So usually you see this for patients that are about to be discharged and they've had a lot of IV antibiotics, and now we got to replace their normal flora before we discharge them from the hospital. And these pills are going to be, they're pills, but they're going to be in the refrigerator because the pill is actually a living bacteria that you swallow, and then it populates your gut to replace your normal flora. Interesting, right? Last but not least, vitamin C prevents colds. So I want to talk about vitamins though. Vitamins can be divided into two categories: lipid soluble, water soluble. Lipid soluble vitamins is vitamin D, E, K, and A. DECA. D-E-K-A. DECA. DECA is lipid soluble. DECA can kill you in an overdose. So the lipid soluble vitamins, overdose, lethal. The water soluble vitamins, that's vitamins B and C, water soluble. All of the B's, because there's different B vitamins and there's C vitamins. Those are water soluble. You can only absorb 100%. Anything you take extra, you're just going to urinate it out. So you can't overdose on vitamin B. You can't overdose on vitamin C. You're going to urinate it out. Now, mind you, B12, which is like Red Bull, you can take enough of it that it's going to give you palpitations and you can start to see sound at some point. But technically you just urinate it out. Yeah, you can't overdose on them because they're water soluble. But the lipid soluble vitamins, those can kill you. We'll reinforce that concept later in the course. I don't know if it's in Pharm 1 or Pharm 2, but you need to know now that DECA is lipid soluble and B and C is water soluble. So this is discussing vitamin C to prevent colds. Make sense? Good. So lies over the counter stuff. Last but not least, just patient teaching regarding CAM. Because remember, we don't recommend that patients take this. I'm just educating you what I learned in nursing school, but that's a good conversation for you and your doctor. But look at some of the bullet points we have here. Number 1, include questions on the use of CAM and their medical histories. Do you use over the counter? What do you use? How often do you use them? Ask those kinds of questions, especially during admission to the hospital. Look at the next one. Ask the patient, articulate what benefits that they are receiving or expect to receive from these over-the-counter stuff that you're taking. See that? Look at number 3, other things to ask the patient. Never take any dietary supplement without first discussing it with your healthcare provider, especially if you're already on a prescription drug. Double check with your prescriber before you start incorporating some CAM that's over-the-counter supplements and stuff like that. Look at the next one, number 4. If you're pregnant or lactating, consider that you might have to come off of those over-the-counter supplements you're taking. Look at the next one. Be aware, older adults. Remember what we said about older adults. Older adults have older kidneys, older hearts, older livers. So the same garlic dose that an adult takes might hit an elderly person even harder and give them even more blood thinning and more potential for a bleed. You see that? And then so consider the patient's age, right? And then the next one, allergies. You never know. You could be allergic to some of this stuff as well. Down at the bottom, it just kind of says, do not take more than the recommended dose on the package insert. So if the thing says only take 2 tablets, then only take 2 tablets. Taking more, again, just because it's over the counter, just because it's herbal, just because it's natural, doesn't make it safe. The emphasis for this chapter is the G's. Yeah, and everything on that table on, what is it that we highlighted on table 10.2, page 107. I might throw a question at you like, which of the following is an example of CAM? Just to see if you're aware, table 10.1, that CAM is more than just pills. So I think I'm probably going to throw in a test question just to make sure that you're aware that CAM also includes physical, psychological, and combinations of physical and psychological, and then examples of it, just to keep that fresh. But our focus is going to be that table 10.2 and the ones we mentioned. Trust me, they're going to come up later again in the chapters. Yeah. Alrighty, that's a short chapter. Kept it a short video too. We'll see you on the next one. Bye.